The main contributor to the rise of annual healthcare premiums is medical inflation. But what is medical inflation? The term medical inflation refers to medical trends and developments and the increase in costs associated with supporting it. This often includes the costs of advanced treatments and procedures and the increased availability and usage around the world. Hence, the expenditure on health has increased year to year, affecting governments, employers, and individuals. But what contributes to medical inflation? There are four major contributors: rising costs of medicine and specialty drugs, medical technology and innovation. We are living longer. We are becoming more overweight and unhealthy. Data from the Organization for Economic Cooperation and Development have consistently showed the average unit costs for U.S. physicians, hospitals, facilities, and drugs are the highest in the world. Particularly, drug spending will increase as the expensive specialty therapies enter the market. The upward trend in specialty drug spending continues, largely driven by market forces, lack of generic medicines, and limited competition are credited with the higher drug price inflation. Medical technology and innovation. The PricewaterhouseCoopers medical cost trend behind the numbers reported that medical technology and innovation are recurring drivers of healthcare cost. New technologies can improve the outcome and patient satisfaction, but tends to cost more as opposed to existing standards. Research suggests that new technology can increase medical costs by 25%. We are living longer. The world is aging at a rapid rate, and by 2030, there will be 34 nations where more than 20% of the population is over 65. This has broad implications for economic growth. With age often comes illness. So, with such a large proportion of the global population relying on their health insurance to help with their conditions as they get older. And while we are living longer, we are yet still becoming more unhealthy. Individuals who practice unhealthy lifestyles needed more healthcare services, which forced them to spend much more on healthcare. Medical inflation is created by several impactful variables, and these are the primary reasons why healthcare-related costs continue to rise.